So let me correct myself.
Okay.
I speak on my behalf when I said my generation don't know how to use these things. They actually do.
What to say?
I'm a millennial.
I was about to say you are a millennial. Aren't you?
I'm a millennial,
Yeah.
but I didn't get the memo
Okay.
that I'm a millennial. Because apparently, me personally, I'm Gen Z.
Do you know like the Gen Z term? Do you use TikTok?
I don't use TikTok.
Okay.
I just had to tell a patient that her investigations, she should maintain her steez. Because she's doing fine.
Hi everyone, I'm here with my favorite millennial physician. This is Dr. Nubwa. Dr. Nubwa, thank you so much for being here.
Yeah.
And everybody, welcome to the Med to Be. Today I have a very special episode. I'm here in Nigeria visiting my family, and I thought it would be a beautiful idea to speak with a physician who has experience working and treating patients on the continent, just to get feedback on her experience as a physician here, and what a day in the life looks like, and how culture is infused into her practice. So thank you so much.
Yeah, you're welcome.
With such a drastic patient to physician ratio, you definitely are required to work very hard, work with a lot of people. What does work-life balance look like for you right now with so many tasks?
So the thing is, number one, the fact that you are working in something that you're passionate in.
Yeah, so true.
It's not only about being a doctor, because you have people that are passionate about being doctors, but they are not in the specialties that they really love. So for me, being a family physician, it was a blessing that I actually found that niche in medicine that I actually truly loved doing in the first instance. So yes, the workload is exhausting, but at the end of the day, when I sit down with my family, because yes, I'm a wife and a mother, so when I sit down with my family and we're having, for instance, an evening devotion, I still take the time to remember those particular patients that impacted me. I'm not sure how I impacted them, but they impacted me in terms of how they responded to the treatment, in terms of how they responded to the bad news I was giving them, in terms of their willingness to even access care, right? So it's tough. It is really tough, but I wouldn't have it any other way.
Wow, that's beautiful. It's always a beautiful thing when your career aligns with your purpose and aligns with passion.
Absolutely.
That is I'm realizing it's more rare than I thought. A lot of times people do things for the money or for the what do you call it, the affordability or the comfortability. But to have a career that meets all your needs is just a beautiful thing.
It is.
How did you find yourself becoming a physician? Did you want to be a doctor since you were a child? Did your parents say doctor, lawyer, engineer? What was the
well, my mom was a vet. So I grew up with some animals. I didn't like all of them, but I always imagined myself doing something with dogs, canines, right? But over time, Nigerian factor, my father sat me down and was like, you know you can't do that for a living, right? So I was like, what's the next best thing that would still put me on a medical track? And it was medicine. And fortunately enough for me, my grades were good enough to actually do medicine. So I did it. And let me tell you, I regretted my life in medical school. It was horrible. And the thing is, what we were learning are things that I actually wanted to learn, but the outcome from the exams were not correlating with the excitement about learning new things. So it was hard in those, thanks to the ASU strike and everything. Something that should have been a 6-year duration ended up being 8 years, right? So it was difficult. And then leaving medical school, I found myself attracted to almost everything. Right, because whether it was treating pregnant women, I loved the pregnant women. Whether it was treating the kids, I didn't like the parents, I loved the kids.
These are people keep saying
Whether it was in internal medicine, watching people die, it didn't give me joy watching people die, but being around their family in those difficult times of dealing with the diagnoses and having to go through that long journey and giving them hope, I wanted to do internal medicine. And then in surgery, I wouldn't say I loved cutting, but the adrenaline of being in a theater room I loved it. So the challenge now was, which one are you going to do? And I hated the idea that I had to make a choice of one.
Yeah.
And then during my NYC year, which is a service year, I met up with my mentor, and he looked at me and was like, so why don't you do family medicine? And I was like, what is family medicine? And then he smiled and he said, it's everything.
Exactly.
And, and I was like, okay, because within a week, I assisted him for a herniorrhaphy. Within that same week, I was with him for immunizing babies. Within that same week, I was assisting with the antenatal care in the insurance department.
Wow.
You understand? So I was like, no, this is where I was supposed to be.
Wow.
This is where I was supposed to be. And then coupled up with the fact that family medicine had that extra thing about the biopsychosocial model of care, made it that the things I loved about mental health were in family medicine.
Wow.
So there was no contest.
Wow.
There was no contest.
Wow. It's like you are exactly
where I was supposed to be.
Wow.
Yeah.
Wow.
So there was no contest.
I truly feel like this is I thank God for bringing us together, because I too want to be a family medicine physician. Like that's one of the reasons I love people. I love all types of people, all age groups. I also see like you strike me as someone that's very multifaceted. You like to do different things. You have a family. You have different passions.
Yes.
So for someone who is a lover of things, a lover of people, I feel like family medicine is a great space to be in.
Yes,
so
it is.
It's great to see that that's the same across the world.
Yeah.
One beautiful thing I want to talk about the strengths of the Nigerian healthcare system. What you think the strengths are. I think Nigeria is a very resilient, very strong nation. Yeah. And I think a lot of times we tend to focus on the common missteps, or what comes to living in a growing or a developing country. Yeah. I want to focus on the strengths of the healthcare system in Nigeria.
So there are a lot of challenges, but you've already said something very important, which is resilience. For me, the strength of the Nigerian healthcare are the people that work in the Nigerian healthcare system, because you have people that, other than the fact that they love their country, so the thought of living because of brain drain is alien to them. It almost becomes simply because they don't have a choice. That's why you have made situations so difficult that they don't have a choice but to survive. Yes. But then again, you still have people that are willing to stay, not just because of financial implications of having to leave the country, right? Because right now it's really expensive if you want to leave. But you have people that genuinely love it here, and they don't want to leave here, and they love the improvisation that we get to do with medicine. For instance, you don't have the equipment, so you have to think out of the box how to get things done with the little that you have, right? So for me, it's the people. You have people that not just love the practice of medicine, but they love the land that they live on. They love their fatherland, their motherland, whatever it is you want to call it, you know. It's the people. Wow. That's the strength.
Wow.
Yeah.
That's great. And you, again, I want to say, like, you're not speaking for the whole country of Nigeria, Nigeria's healthcare
system. No, I am not.
not.
I'm not.
So she's not.
I'm speaking for the healthcare professionals and the healthcare workers that I have worked with and have motivated me to keep going, because we motivate each other.
100%.
Because, well, we want to stay.
100%. And in that framework, I just want to touch briefly on what you think maybe some possible resolutions are for the common challenges people usually talk about in the healthcare system, like the brain drain.
Yes.
Like the having to be creative and have to use certain resources that aren't available. Yeah.
So the most recent one that I encountered, and I would ask all my other healthcare brothers and sisters to accept my apology, because I honestly didn't know that there were disparities in our professions. For instance, the pharmacies have peculiar challenges that we as doctors don't have to face. The same thing with the nurses, the same thing with the medical technicians, the same thing with the physiotherapists. There are intrinsic disparities amongst us that have made it even difficult for us to work as brothers and sisters. For me, I am fortunate to be able to work in a facility where those institutional disparities have not impacted how we're able to deal with our patients. So we know amongst ourselves in this particular facility that we work as a team. Yeah. But when you step out of this facility and you are faced with what goes on in the public domain, oh my Lord, the differences are there, right? And that is just within our own healthcare professions, our individual niches of where we are. And then you look at the whole system as itself. Let's not even go to corruption. Let's not even go into lack of the equipment that we need to work with. Let's not even start talking about that, because those are dead donkeys that have been overflogged over the years. I unfortunately was made to understand that I have privileges as a doctor that my other healthcare workers don't. And for me, I was humbled that I even have flexibility. I was humbled by the fact that I had choices that they don't have. And I honestly feel that that is unfortunate.
Wow. Thank you so much for your feedback. Just two more questions.
Okay.
I want to touch on the cultural scope of treating different patients.
Right.
There's so many different tribes, so many different beautiful cultures in Nigeria, and with that comes language barrier. With that comes cultural barrier, educational barrier, diet. Like, there's just so many socioeconomic factors that go into play with treating a patient. What are some things that have helped you treat every patient the same? And one thing I really liked about you when I first met you, I met you when a family member had come to see you, your countenance and the way you explain information is so palatable to someone who does not even understand the medical terminologies, which I think is amazing. What are some tips that helped you to get there? And in retrospect, and in flipping it back to the patient coming to you, what is something you think that Nigerian patients can do to kind of take advantage of a relationship with a physician?
Okay, so the thing is, in the foundation of being a family physician is put the patient first. And the patient is not a patient, the patient is a person. And you're looking at the patient in the context of a larger ecosystem, which is his family and his society. So for me, that's not difficult, because I think for you, you would call it a blended family, because I come from a background that has different cultures, like you've already identified, and religions. So I already had that background of balancing that out already. How to be careful with what are the things that are offensive, what are the things that could put people off. So I already had a little background on that, and then only to find that that was potentiated by being a family physician, because you are the patient's educator, you're the patient's counselor. So you have to learn how to communicate in a way that helps the patient understand not just what he's dealing with, but accept the care that you are offering in a way that gives him the independence and control to make sure that he meets the goals and objectives that both of you have agreed on.
What can a patient do to take advantage of the relationship or the time that they have with you?
Come in. So unfortunately, patients get this so well. I shouldn't even call them patients, because I should call them people in the community. People in the community get it so well. I've had situations where people have come in because they were able to identify red flags at home, but were not able to get the care that they needed when they actually came into the hospital. And it's discouraging. I mean, I go to church and I hear people give the testimony that the doctor gave them a bad report. So FYI, I'm not in the Department of Hell, and I'm not an associate of the devil who is programmed to just give you bad news. So please, FYI, right?
That's a good one.
In as much as we are exhausted and overwhelmed, continue coming, because it is our responsibility to give you the care that we are able to give. Whatever quality it is that we are able to provide, it is your right as a patient to access that. You understand?
So true,
So keep coming.
So true.
Keep coming.
Yeah.
Even if you have had disappointing experiences in the past, that shouldn't stop you from still trying to get the care that you deserve. Keep coming.
Wow, thank you so much.
We will eventually get it right.
Yes.
By the special grace of God, we will eventually get it right as a healthcare system in Nigeria. But for the patients, please keep coming, because you deserve the care that you need.
So true. Thank you so much.
Yeah.
Wow. My last question, I always do this. I call them to the meant to be, where I ask the person I'm speaking to kind of share a message with the future generation of physicians, future generation of healthcare professionals. If there's a word of encouragement, a word of advice you think you could share from your story, or there's something you want to see in the future generation.
So number one is do unto others as you would have them do unto you, because every patient that comes into your consultation room could have been you. Treat them as if you would yourself. Treat them as if you would a family member. Treat them as if you would a relative, because you never know. You never know. You never know. This world is too small right now for you to assume that the patient that walks into your door is just another patient or just another case. So in as much as you are going through a lot, you have no idea what this person is going through that just walked into your office.
So true.
And it could be you. So treat them as you would yourself. Yeah.
Wow.
That's basically it.
That's great.
Okay. All right.
Wonderful. Thank you so much, Dr. Nubwa, for being here.
All
It was truly a blessing to have this little moment with you. Thank you so much for taking the time to speak with me. I hope you have a wonderful rest of the day.
Yeah.
Thank you so much for taking the time to speak and watch this, guys. Please send Dr. Nubwa your words of encouragement. I'll go off in the comments and just send her so much support. Thank you so much.
Yeah. Thank you. All right.
Bye.
Honest conversations on the meant to be. Black health professionals sharing, professionals caring. So come and join our conversations and get all the insight that you need.